Okay, I'm washing my hands. Good afternoon, Ryan.
Matt, good afternoon.
My name is Katrina. I'm going to be performing your head to toe physical assessment. If you don't mind, we'll get started.
Okay, sounds good.
Okay, so first I'm inspecting all skin that's visual to me, and I'm not noting any open areas, no dryness of the skin, and no edema. I'm going to start by palpating your scalp.
Okay.
Okay. So scalp is normal cephalic, not feeling any lumps or bumps. I'm going to feel your sinuses. Tell me if you feel any tenderness.
Okay.
Frontal and maxillary, any tenderness?
No tenderness.
Okay, next I'm going to feel your lymph nodes. Pre-auricular, post-auricular, tonsillar, occipital, posterior cervical, head up for me here, submandibular, submental, cervical chain, and supraclavicular. And I did not note any enlargement and did you feel any tenderness?
No.
Okay, thank you. What I'm going to do next is palpate your trachea and make sure that it is midline, which it is. And then I'm going to ask you to take a sip of water while I walk around the back, and I'm going to be feeling your thyroid.
Okay.
So if you can take a sip. Wonderful. So I palpated the thyroid to feel for enlargements. There was no enlargement, there were no nodules, and your thyroid moved up and down when you took a sip of water. Next thing I'm going to ask you to do is shrug your shoulders while I put some pressure. Go ahead, shrug. Wonderful. Thank you very much. Okay, what I'm going to do now is move on to the assessment of your eyes. We're going to test visual acuity. If you can hold this 14 inches from your eyes and just tell me the smallest line you can read.
Okay, it looks like this one 837,826.
Okay, so that is 20/20 visual acuity on the Snellen chart. Thank you.
You're welcome.
What I'm going to do next is test your peripheral vision. I'm going to put my hands behind your head, wiggle my fingers, and you're going to tell me when you can see them, okay?
Now.
Okay, so that was 90 degrees peripheral vision, so that's intact. What I'm going to do next is test accommodation. If you could look straight ahead and then put your eyes on my finger, I'm going to move them closer to your face. Okay, look away. All right, good. So your pupils constricted when my finger was moving closer to your face, which is normal, and then dilated looking at an object farther away. What I'm going to do next is test your extraocular eye movement in the 6 cardinal directions. So if you can keep your eye on my finger and keep your head straight, I'm going to move in 6 directions. Okay, and what I'm doing here is looking for any tremors or nystagmus of your eyes, and I'm not noting that. And what I'm going to do next is check pupillary constriction. So if you can look forward for me. Thank you. Good. Okay, so pupils did constrict. They're equal and reactive to light. What I'm going to do next is I'm going to be taking a look inside your eyes. So what I'm going to have to do is go a little bit close while I'm doing this. And I'm going to take a look one eye at a time, okay?
Okay.
Okay, thank you. Okay, go ahead. All right, I'm noting a red reflex. I'm seeing the optic disc, and vascularization is normal without any hemorrhages or aneurysms. Okay, so I'm going to take a look at the next eye. Same thing. Noting a red reflex, optic disc, vascularization is normal without any hemorrhages or aneurysms. Thank you for that. What I'm going to do next is take a look inside your nose. You can leave your head just straight down. Thank you. Okay, I'm seeing superior and medial turbinates. They're pink. Superior and middle turbinates, medial turbinates are pink. I did not know any septal deviation. I'm going to switch out the tip here. And I'm going to take a look inside of each of your ears. So noting from looking at your face, they are symmetrical bilaterally. And I'm going to be pulling your ear up and back. I'm noting that the auricle is without any deformities. And I'm going to be pulling your ear here. This is how we check ears for adults. Okay, so I'm not noting any wax. Tympanic membrane is pearly gray, translucent. Ossicles are noted, and I see a light reflex. Coming around on the other side to do the same thing. Oracle of the ear is without deformities. I'm going to be pulling your ear up and back again. Okay, no wax. Tympanic membrane is pearly gray, translucent. Ossicles are noted, and so is a light reflex. Thank you. Next, I'm going to be taking a look inside your mouth. So if you can open up for me, say ah.
Ah.
Okay, great. So I do not note a blind pouch. Mucous membranes are pink, intact. Uvula is midline. Say ah one more time.
Ah.
Soft palate rises symmetrically. I do not know any dental caries. I'm going to be testing your gag reflex now, okay? Thank you. If you can please now stick out your tongue and move it to the left and right. Thank you very much. Now what I'm going to do is start your chest examination. So if you could just unbutton your shirt a little bit. First, we're going to talk about the breast examination. I'm not going to palpate for this, but normally first what we would do is inspect. I am looking for any dimpling or puckering of the skin, any redness, or any masses that might be visual. I would then palpate light, medium, and deep in a vertical fashion, up and down, feeling for any masses, and then I would feel deep in your axilla for axillary lymph nodes that might be enlarged. At this time, since we're already at your chest, I'm going to be moving to your respiratory assessment. So first, I am visually inspecting your rate of breathing. So you're breathing about 12 to 14 breaths a minute right now. It's not any effort for you to breathe. You're not currently using any accessory muscles. So then I'm going to take a listen to your lungs at the front here, okay?
Okay.
All right. Can you breathe for me? Wonderful. Thank you. I'm going to be listening to the back of your lungs now. If you could remove your shirt so I could have a good listen. And I'm also going to be palpating. This will be to be checking that your diaphragmatic excursion is symmetrical. So I'm just going to have you turn a little bit so the camera can see where I'm putting my hands. Thank you. So sit up straight for me. And if you could take a breath in and out. Wonderful. So that was equal expansion of your lungs there. And I'm going to be taking a listen in a ladder formation to your lungs. Breathe in. Wonderful. And lift this arm a little bit on the right side. Just going to take a listen, another deep breath. Wonderful. And it's important to listen there to the right middle lobe. That's where we can hear it best. So I heard clear lung sounds. There were no adventitious sounds there.
Okay.
What we're going to do next is move on to the neurological assessment. I'm going to give you a pen and a paper, and if you could draw a clock with the time at 11 o'clock. And we'll just go through the cranial nerves that we already tested. We are able to leave out the olfactory, which would be the smell. We already tested the optic nerve using the visual acuity chart. We already tested the ocular motor, the trochlear, and the abducens using looking at your pupillary reaction, which was appropriate, as well as your extraocular eye movements. Thank you very much. As you can see, the clock is drawn intact. So that was to test for any Alzheimer's or dementia, and you drew the clock appropriately. Okay, what I'm going to do now is test your trigeminal nerve, which is sensory and motor. So I'm going to have you close your eyes and you tell me if you feel on your forehead sharp or dull.
Dull.
Okay.
Sharp.
Okay, close your eyes. And now on your cheeks.
Dull. Sharp.
Okay, thank you. If you can open your eyes now, what I'm going to do is test the motor portion of that, and I'm going to have you clench your jaw when I feel, and unclench and clench. Okay, good. So you have good strength. So the trigeminal nerve is intact. Next, that would be the facial nerve. So I'm going to have you smile. Good. Frown and puff out your cheeks. Wonderful. That's intact. Next is 8, which is acoustic. I'm going to go behind you and do the whisper test.
Okay.
If you can please block one ear at a time and repeat to me the word that I'm whispering.
Doctor.
And the other?
Doctor.
Wonderful. So the acoustic cranial nerve is intact because I'm assessing your gross hearing by speaking to you and you understanding me correctly, but you also passed your whisper test. Your gag reflex was intact, and that was testing your glossopharyngeal as well as your vagus nerve. You already shrugged your shoulders. That was testing your spinal accessory nerve, which was intact. And you moved your tongue left and right, which tests your hypoglossal nerve, which was intact. Okay?
Great.
Wonderful. Now I'm going to have you close your eyes. We're going to do something that's called ceregnosis. Close your eyes. And you're going to tell me the object that I place in your hand. You're going to describe it to me. And what is it?
Paperclip.
Wonderful. Thank you. So that is intact. And next, I'm going to be testing some motor coordination. If you can please take your finger and move from my finger to your nose, fast, repeated motion. And next, hand. Wonderful. So you had smooth coordination, so that's good. What I'm going to do now is move on to your cardiovascular assessment. So I'm going to take a look at your neck, and I'm looking at your neck veins. And now I'm going to palpate and listen to and auscultate your carotids, okay? So I'm going to feel this one at a time. Very good. All right, so carotids are +2. And I'm going to auscultate, and that's listening for breweries, okay?
Okay.
Okay, no breweries are noted. I'm going to now feel some pulses, and I'm going to feel your radial pulses bilaterally here. They're +2. I'm going to feel popliteal. They're +2. I'm going to feel tibial. +2. And I'm going to feel dorsalis pedis. And they're +2 as well. Next, I'm going to take a listen to your heart. So if you could just open a little bit, I'm going to be listening to the 5 areas of your heart, first with the diaphragm and then with the bell of my stethoscope, okay?
Okay.
Thank you. Listening to 5 areas, so this is aortic, pulmonic, herbs, tricuspid, and mitral. Thank you. I'm going to now listen with the bell of my stethoscope to those 5 areas. Thank you.
You're welcome.
If I can have you lay down now, I'm going to be listening to those same 5 areas with the diaphragm of my stethoscope. Thank you. Thank you. I'm going to have you now lay on your left side. I'm going to be listening with lay on your left side, thank you. This is the left lateral decubitus position, and we can hear S3 and S4. Heart sounds better here, which is why I'm taking a listen in this position, and then I'm going to feel the point of maximal impulse, okay? Okay, and now I'm going to feel. So I did not, okay, point of maximal impulse, I feel, and it is not displaced. And then when listening to your heart, I did not hear any S3 or S4 heart sounds. I did not hear any gallops. I did not hear any rubs. You can lay on your back now, please. Thank you. All right. So first what I'm going to do in this position is test for meningeal root irritation. So I'm going to put my hand underneath your head and I'm going to passively flex your head. Do you feel any irritation, any pain?
No.
Okay, thank you. While I have you laying, I'm going to move on to your abdominal assessment. So first I'm going to, can you undo that button? I'm going to inspect your abdomen and I'm looking, thank you, I do not know any scars, a flat abdomen, and I'm going to now take a listen to the 4 quadrants for bowel sounds, and then I'm going to listen to renal arteries, okay? So I'm hearing tinkling, I'm hearing gurgling, normal active bowel sounds. I'm going to take a listen to the renal arteries at this point. Okay, no worries noted. Next, I'm going to palpate in 4 quadrants. I'm feeling for any masses, and can you please tell me if you feel any tenderness?
No tenderness.
Okay. And I'm going to feel in all 4 quadrants lightly first, and then I'm going to feel a little bit deeper, okay?
Okay.
Any tenderness?
No.
Okay, I did not know any masses. Next, I'm going to be feeling for your liver. I feel that right at the right costal margin. I'm going to be feeling your spleen now. And the spleen is not palpable. What I'm going to do now is test McBurney's point. So I'm going to push down in the area of your appendix, and what I'm looking for is rebound tenderness. Any tenderness there?
No.
Okay, good. Next, what I'm going to do, you can cover up because I'm done with that, is I'm going to be lifting up one leg at a time, and we're testing for nerve root irritation here. So tell me if you feel any pain, and I will lift your legs up, okay? Any pain?
No pain.
And great. And just try to kind of leave it, your leg straight for me.
Okay. No pain.
No pain. Okay, wonderful. At this point, I'm going to move and finish my inspection of the skin with looking at your feet. So I'm going to sneak around here. Thank you. I'm going to take this in here. So I'm looking at the skin of the feet, and there are no open areas. There are no sores, no odor to the feet. I'm going to test capillary refill while I'm here, and each one was under 2 seconds. I'm going to be testing sensation. So if you can please tell me, like we did with your forehead and your cheeks, if you're feeling dull or sharp.
Okay. Dull.
Okay, good.
Sharp.
Okay, and now?
Dull.
Okay.
Sharp.
Wonderful. So that was intact. You were right with all of those. What I'm going to do now is test your Babinski or plantar reflex, okay?
Mm-hmm.
So, can you slide up a little bit?
Yep.
Perfect, thank you. All right, here we go. Did that tickle? I'm very sorry. I'm going to do that again. Wonderful. And again. Wonderful. So that was intact. I'm going to now test vibration. So if you can please tell me, without looking, which foot you feel vibration in.
My left.
Okay. And now?
My right.
Okay, thank you very much. While you're laying, we're going to finish up. We're going to do some range of motion with your hips while you're laying, because this is the easiest way to do it. So we're going to test hip adduction and abduction, okay? So first what we're going to do is move away from your body. That's abduction. So I'm going to have you move your leg out. Good. And then over across the other leg. Wonderful. And that is adduction because it goes towards your body. I'm going to have you do the same thing with your other leg. Out and then in. So you have good range of motion with your hips. Next, we're going to test internal and external rotation. So if you please, I'm going to flex this knee, and I'm going to have you move in, internal, and then out for external. That's good range of motion. And then I'm going to have you do the other side, in, and then out. Wonderful. Thank you very much. At this point, I can have you sit up, and we're going to do some range of motion and testing strength. So first I'm going to have you turn your head and I'll have you turn your head to one side and then to the other side. So that's good range of motion. And now what I'm going to be doing is testing neck strength. So I'm going to be giving you some resistance as you turn, okay? So good, and then this way. Wonderful. So that's 5 out of 5 strength in your neck. I'm going to have you do some flexion and extension of your elbow. So if you could flex up, good, and then extend, that's good range of motion. I'm going to have you do the same thing with me putting some resistance on your hands, on your arms, I should say. So go ahead and flex for me. Good. And then extend. Wonderful. So that's 5 out of 5 strength, and that was testing your biceps and triceps. What I'll do now is test lower extremities. So I'll have you one leg at a time. I'll have you extend your knee up and then flex it, and then the other one extend and then flex. And then I will have you do the same thing, but I'm going to be providing some resistance. So here, this leg first. Good. Very good. Next one. Good. Good. So you had good range of motion with both of your knees. Testing your strength, you had a 5 out of 5, and that was testing your quads and your hamstrings. I'm going to have you now do some flexion and extension with your feet. So if you could flex them up and then point them down, and then I'll have you do the same with some resistance. Go ahead, flex up and extend them down. Very good. So that was good range of motion of your ankles with 5 out of 5 strength. I'm going to palpate your joints now. So I'm going to feel major joints, and I'm feeling your shoulders. I'm going to feel your elbows. Feel wrists. I'm going to feel some knees. And I'm palpating and I'm feeling for any warmth, tenderness, any swelling. As you're moving, I did not feel any crepitus when I was testing strength. And in all your joints, I do not feel any tenderness or any swelling. Did you feel any pain when I palpated
No, I
anything?
did not.
Okay, wonderful. The next thing we're going to do is test your reflexes. So the first thing I'm going to, could you roll your sleeves up? I'm
Sure.
going to, thank you. It'll be a little bit easier to see your responses this way. That's good. On both arms though, because we're going to do both sides, sorry. Okay, so first I'm going to test your biceps reflexes on both sides. So what I want you to do while we're testing reflexes is just kind of stay without any muscle tone, just kind of relax whatever we're testing. So I'm going to have you do this. And I'm going to test biceps reflex. Okay, and then we'll do the same thing on the other side. Okay, and we're going to test triceps reflex. So if you could kind of have just dead weight in my hand here. Okay, wonderful. On the other side. Same thing, just dead weight here, wonderful. Good. So biceps and triceps reflexes were +2. Normal reactions. I'm not done. We're going to do brachioradialis. Okay, ready? This will be your thumb. Okay. Then this side. Brachioradialis. Thank you very much. All right, so reflexes were +2 there. I'm going to move to the patellar. Just try to sit as back as far as you can with your feet still dangling. Okay, and here. And the next one. So that was +2 bilaterally, and we already did the plantar or Babinski reflex with your toes curling in with an appropriate response.
Okay.
So what we're going to do now is I'm going to have you stand up. We're going to do one more test for muscle weakness and test the range of motion of your shoulders.
Okay.
So can you squeeze my hands? I'm testing for any muscle weakness. Good. So your squeeze was appropriate and equal. So you had no weakness there. And I'm going to have you do some range of motion with your shoulders. So if I can have you put your hands all the way up and then extend them behind your back. And then I'm going to have you cross them in front of you and then open your arms wide. So it's very good range of motion for your shoulders. The next thing that I'm going to do is take a look and palpate your spine. I'm sorry, I'll take your shirt off for that. And what I'm going to be doing is making sure that your shoulder blades are symmetrical and your hip bones symmetrical. Thank you. So, and they are, and your hips are symmetrical. I'm going to have you just lean forward a tiny bit so I can take a feel. Good. Palpating your spine midline, not feeling any abnormalities, and you can put your shirt back on. We're going to now test your gait. So I will have you take a couple steps away from me, and you could button your shirt first. Because we're also going to be looking at the way you move your arms while you walk. Okay. Wonderful, and then a couple steps towards me. So your gait was smooth and coordinated. You had alternating movements of your trunk and upper limbs, which is appropriate. So next I'm going to test balance. If you could stand just like you are with your legs hip width apart and your arms by your sides. If you can close your eyes, and I'm staying close in case. Great. In assessing this balance, he's swaying the slightest bit, but there's good balance here. You can open up your eyes. Do you have any questions about your assessment?
No.
All right, well, we're all finished. Thank you very much.
Thank you.